Today we're going to talk physical therapy, and as luck would have it, we have two physical therapists with us.
That works out well.
Brianna, good morning.
Good morning.
And Connor.
Good morning to you guys too.
Yeah,
Good to have you guys with us. So tell us how you make physical therapy fun.
Well,
They're looking at each other.
I always find exercise fun, but it's always important to make sure you cater your exercise plan and your plan of care to the patient. So if they're more of a sport related person, you try to incorporate sport related activities in their plan, or if they're more just wanting to get back into a walking program or getting back into hiking, you try to really incorporate a balance, or just trying to make sure it is as interesting to the person that you're treating as possible.
See, I was told that the difference between a physical therapist and a terrorist is you can negotiate with a terrorist.
Oh yeah, I've never heard of that joke before.
Yeah, sure. Yeah, I've been through physical therapy a number of times because I'm accident prone, apparently. But anyway, are we talking post-accident, post-surgery, or just for somebody who needs to get back in shape?
It's for anyone, really. If you're dealing with pain, we can treat anybody with pain, balance deficits, stuff like headaches, dizziness, things like
Really?
that. But we do treat a lot of post-surgical patients as well.
Okay.
Headaches, and how does that work?
Well, a lot of headaches stem from posture. So a lot of times we can work on postural exercises, neck disorders, dysfunction, and dizziness also. Dizziness plays a big role in headaches too.
But dizziness, how in the world do you, isn't that a brain thing?
It is, but it's also a lot of musculoskeletal, so strength training, visual stuff. So we use a lot of different fun tools. We got foam, we've got cones, we've got lots of things that we can kind of put people through obstacle courses and just challenge balance.
Well, that even sounds like it might be fun.
It is kind of fun, I think.
I'd say it's fun.
It's fun for them, John.
Is what we're doing forcing movement? Is that the idea?
That is the idea.
That
yes.
is the whole idea. Yeah, if
Yeah.
you stop moving, things tend to go wrong. So if we want to make sure everyone's moving as much as possible, and if you're moving more and you're stronger, you tend to be more resilient to whatever life throws at you.
Okay, I got a plantar fasciitis deal going on right now. Had it 20 years ago, and I don't know why all of a sudden. And is there anything you can do about
The
that?
20th anniversary, Robbie.
Yeah, I guess we're celebrating here. The reason I asked is the doctor I went to 20 years ago. I said, I don't get it. It's like I broke my heel, but I didn't have any, no impact. And he said, it's plantar fasciitis. And I said, well, what do we do about that? And he says, it'll be better in 6 months. And I thought,
Is that
great.
your approach, Brianna?
No, we can definitely help with plantar fasciitis. So a big thing with plantar fasciitis is shoe wear. So having good supportive shoes, but also your calf muscles play a big role in plantar fasciitis and your ankle mobility. So a lot of times when you have plantar fasciitis, you have a lot of tightness in your ankles. So we work on a lot of stretching, strengthening, and improving overall ankle function.
Now, that leg, I've had a compound fracture, a broken ankle, lots of mishaps
And two new
problems.
knees.
Yeah, I'm through with replacement parts for now, I think.
If I could build off of what Brianna was
Sure.
saying, if think about your feet as like roots in a tree.
Right.
If you have very shallow roots, you're never going to really have a good foundation for the tree. The tree's always going to blow over. But if your roots are deep and they're strong,
They're
like
size 13.
but your foot muscles, if the foot muscles aren't as strong and then that foundation isn't there, you're always going to have difficulties, maybe even at your knees, at your hips. So it's a ground up approach with PT,
Can you actually
with plantar
strengthen
fasciitis.
Can you actually strengthen your foot muscles?
Oh yeah, yep, you sure can.
That must really be something.
You pick up pencils with your toes, or what do you do?
I have people pick up marbles with their toes.
Really?
Yeah, that's a great way to strengthen your
Wow.
feet. Balance, going back to balance, that's a great way to strengthen your feet muscles too, because our feet muscles are always active when we're balancing.
Wow.
Yeah.
I've done toe raises and things like that, and
Toe raises. You could. There's a lot of different foot. We have a good time showing you some foot exercises.
So,
So
Ray,
you're-
what's really the benefit of physical therapy? What really is the big deal?
Well, we want to optimize people's mobility. We want you to move well, pain-free. We work with all age groups, so I see a lot of athletes. I see individuals who are retired, and they want to be able to go out and do a lot of their hiking activities, walking activities, and basically want to optimize function and get people back to where they want to be and allow them to do all their activities that they love.
So we kind of highlighted a couple of conditions. Robin brought his to the table.
Always.
What
Sorry.
else can we treat with physical therapy?
We can treat a multitude of diagnoses. So going on either across the board on orthopedics from the head to the toe, but then you can also have neurological conditions as well. So we see Parkinson's patients, MS patients who have been experienced a traumatic brain injury, a spinal cord injury. So there's a multitude of diagnoses that we treat at Logan Health.
Oh, Parkinson's, it just seems like we're hearing that an awful lot. Saw an interview last night with Michael J. Fox, and he's obviously entering the later stages of Parkinson's. Why do you think we're seeing so much of it around here?
That is a good question. I don't know if I have the answer to the why we're seeing more and more of it.
Is it just because we're living longer and we're more active in our later years?
I was probably just going to go with that, just as the easy answer, but truly I don't have the answer
But
for that.
what can you do when somebody's motor movements are compromised like that?
So for physical therapy, we work on movement with Parkinson's. So with Parkinson's, people who have Parkinson's tend to have smaller movements, tougher time moving. So it's called LSVT, big movements. So we work on making big movements and encouraging that. Our Logan Health location at 205 Sunnyview also has speech therapy and occupational therapy that treat Parkinson's patients as well.
Now, that's interesting because my wife's uncle has Parkinson's, and I didn't realize that it affects the speech somewhat. He said he paused and he says, "Sorry, forget stuff sometimes." But it wasn't like a dementia. It was like a disconnect where he paused for about 20 seconds and resumed. So
When physical therapy can help that?
So speech therapy would help with that. They work on kind of, I can't speak a ton for speech therapy, but they work a lot on just getting patients speaking louder and kind of getting more fluid with their speech. You'll often hear them in their rooms kind of yelling back and forth at each other, trying to get loud. But all the therapies can make a huge difference with Parkinson's.
It must be difficult to adjust to something like that if you're used to being athletic and all of a sudden you're not. How do you work through the mental part of that?
It's a lot of coaching and listening. So PT is just as much the physical as in the mental side of things or emotional side of things with how we treat people. I mean, it's not just I'd say it's 50-50 getting someone back into physical shape as in getting their confidence, listening, and just seeing them as a person rather than a diagnosis.
I used to bench press 300 pounds. I can't do that anymore. And it frustrates me when I try to do something that's even half that now. How do you work through the frustration? My attitude is just give up.
It's finding other things. I think a lot of times it's kind of finding either modifications and things. If somebody has an activity that they love but they can't do anymore, finding things that other passions or other modifications to still be able to get out and do some of the things that they love.
Well, there's not a whole lot of benefits to bench pressing 300 pounds, other than the bragging rights. But nonetheless, it's a mental thing. And when we can't do what we used to do, we sometimes just give up because it's humiliating.
that's one of the things that I've noticed. Like I don't get up on the roof to clean the the debris, the pine needles and stuff off spring
That's
and
a
fall.
good thing, Robin.
Because I've fallen on the ground, so I don't want to take any chances. But there are things that we've done all of our life, and you just know, oh, I can do that. I've always done that, and maybe you shouldn't as you get older. Do you coach people regarding that?
Yeah, I think I was having a conversation about that almost a few days ago. It's the cost benefit, right? I mean,
Right.
going up, especially up and down ladders as we get older. I mean, what's really the benefit of you doing it versus your grandson or
Exactly.
the neighbor kid down the road? I mean,
Yeah.
it's is it really worth you getting up on the ladder and hurting yourself?
Potentially, yeah.
Yeah, but when we're dealing with somebody who's trying to get their movement back, I mean, it's oftentimes a difficult and a lengthy process.
Yeah, it can be a long road. I always tell patients, it's think of it as in the long haul. You've got so many weeks you're going to be working with me, but this is probably going to be a lifelong thing that you're going to focus on with stretches, exercises. You just kind of want to find a good routine of things that are going to keep you mobile and keep you moving correctly.
Well, you're associated with Logan Health now, so you've got lots of options. Talk to me about some of the special services and programs.
In terms of, I guess, could you elaborate a bit more on that?
I mean, just what can you do that maybe another place can't do because you're associated with a medical facility?
Well, we have a direct relationship with most of not most, all the orthopedic docs in our system, along with all the neurological doctors that we see or that we get referrals from too. So it's a bit more of a direct line communication with the referrals coming over to us, and also the communication we have going to the back end with the PAs and the doctors that refer their patients to us.
The facility we're talking about is the old Summit, right? Whatever we call it now. I haven't been able.
Yeah.
What is it? Is Logan
Health Fitness Center, I believe it's called. Yeah.
All right.
It's so easy, but it's so hard.
Yeah. It's a great facility.
Yeah.
You have a lot of equipment. And now, having gone there before, normally you have somebody working with you and they help set up a program, and it's progressive. You can add to it. Is that a similar situation with physical therapy?
It is, yeah. So we always start when on day one, we start with exercises and we build on those exercises.
Okay.
The nice thing about being at the Logan Health Fitness Center is we have access to all that equipment in the gym as well. So a lot of times I can take patients over there and kind of work on other weightlifting activities if patients want to get back to weightlifting. We have access to the pool as well, so we can do some pool therapy. So we have access to a lot of tools and equipment.
As far as gaining access to the services that you've been talking about, does that have to be a referral through a, what do you call it, primary care? Or somebody listening goes, hey, I think I could use that. Can they contact you directly?
So we need a referral to start physical therapy, and that can come, yes, from your primary care provider. It can come from a specialist if you're seeing orthopedics or neurology. And so you just have to reach out to your primary care specialist if you're in contact with them, or even just going into the walk-in clinic, you can request a physical therapy.
Okay, now where's the walk-in
prescription.
clinic?
We have one at our 111, Sunnyview location, and then there's several others kind of around that campus. There's some more walk-in clinics as well.
Okay, very good.
So basically, if you have some contact with the medical facility, you can get a referral in.
Yes. Yep.
Okay.
Yep, that's right.
And as far as the range of things you treat, you said from the top of your head to your toes. Huh?
Yes, that's right. Yep,
Yeah.
we see, anything related to orthopedics we treat, and then like we were talking about earlier, there's a multitude of neurological conditions that we like to treat as well, and we do treat as well.
All right.
What about arthritis? Can you regain some flexibility through physical therapy?
Sure. I'd say PT's never going to reverse the age-related changes that osteoarthritis creates, but we can help you get stronger. So the muscles themselves support the joints more so after you get stronger, and also we can also work on your flexibility and your mobility
So there's
with
a
PT.
wide range of people with conditions that could benefit from coming to see you.
Well, I'm glad we shot some light on all this, Robin. This is terrific, you guys. 2 physical therapists here with us this morning, helping us understand the whole process. Brianna Andrews and Connor Gullig. You guys, thanks so much.
Thank you guys. Yes.